Miss Johnson, the doctor's ready to see you.
How are you doing today?
I'm fine.
Okay, listen. Last week we did your Pap smear.
We did.
Today we have the results, and I'm here to give them to you. The Pap smear did come back slightly abnormal, but that's okay. Do you have any questions?
Abnormal?
Yes. Sometimes.
Abnormal?
Yeah, sometimes.
I knew it was something wrong with
No. Sometimes Pap smears.
This is so much to deal with.
No, listen.
At such a young age.
I know, but this is an abnormal Pap smear. It's not.
I have cancer.
I didn't say all that.
I have cancer.
We're not there yet.
Why would I have cancer out of all people?
That's not
You
true.
know, Doc, now that I think about it, lately, I have been feeling really cancerous. Up in like this area.
But this is totally the wrong area. Like we're talking.
Probably, but you know, it spreads. It can spread.
I'm pretty sure we're not there.
How many days?
Okay, that's.
How many days do I have left?
Just too soon.
I had a whole week planned out for next week. I don't think I'm gonna make it.
Hi, I'm Dr. Jean-Gilles, and in the scene you saw, that obviously was a parody of a patient receiving her Pap smear results, which happened to be abnormal. Now, while this is just a parody, sometimes it's not far from the truth. So today, we're going to discuss what exactly is a Pap smear and what does it mean when you get an abnormal Pap smear result. A Pap smear is a test that tells us which of our patients are at risk and need further evaluation for cervical cancer. It doesn't tell us that it's cervical cancer, but it helps us determine who needs to be further evaluated. Now, Pap smears are normally done every 3 to 5 years, as long as they're normal, and that's dependent on your age. Now, sometimes we do get results that are abnormal. So what does this mean? Well, when we get the results, some results will tell us, hey, this can wait, we'll see you next year. And some results will tell us, hey, I'm not too worried about this, but we should take a closer look. And sometimes there are Pap smear results that tell us we really need to take a close look at this right now. So what do I mean when I say we need to take a closer look? The way we take a closer look at abnormal Pap smears is something called a colposcopy. What is that? Essentially, a colposcopy is a device. It's like a big microscope. And what we do is we take a close look at the cervix and we check for areas that may look abnormal or weird. And if they do look weird, then we may take a piece, which is called a biopsy. And from this biopsy, we'll get our diagnosis. Luckily, cervical cancer is slow growing and is easy to catch early on if routine Pap smears are performed. Every year in the United States of America, about 13,000 women will be diagnosed with cervical cancer. Furthermore, 4,100 women will die from cervical cancer every year. This is a disease that can easily be prevented. Most of these cases, sadly, are the result of patients not getting their Pap smears done on a regular basis. This is a preventable disease and it's easily curable if we catch it early on. I am Dr. Jean-Gilles, and I hope you found this video very helpful.